The people that work in the emergency department are what makes us special. We have so many different disciplines that collaborate to provide that exceptional care and service to the patients that we serve.
So the work of an ED tech is basically helping everyone in the department. You can help hold an IV, you can help with a laceration or holding for a lumbar puncture. You're also sometimes the first people to see the patients.
Well, I've always had a dream of doing something clinical, even from a very young age. I decided that the best course of action for me would be to become an EMT. I started in the fall of 2021. I was worried about whether or not I would get through it. So I would, leave and go to class and study at night, study on the weekends. But really, no one knew, especially not my boss.
I didn't learn about it until after she had successfully gotten her certification. And I was honestly just blown away. Linda carries a huge load. She has everything: people, HR, culture, marketing and communications, legal, compliance, and all of our great work in child advocacy.
I went 2 days a week from 5 p.m. to 10 p.m. and then some Saturdays. And then I had a clinical rotation, which I did at Grady in the emergency department and on the Grady EMS trucks. And that's where I met Ridge.
When I first came to work at Children's, I ended up finding out Linda's position from my new employee orientation, when they were going through our leadership PowerPoints. So I actually didn't know her position until then. I ended up texting her, telling her, I was like, hey, I didn't know you're this high up.
So Linda reached out and she was very interested in coming to work in one of our EDs. I said, let's meet and let's talk about this, because I wondered how, as our chief administrative officer, she would have the time for another position.
And so I began my orientation, and that's where I met Nivea. So she was my preceptor.
The day that I met Linda, I was told they have a new preceptee and that they would be with me for the next 2 weeks. So when I met her, I didn't know who she was. So when she came, I just trained her my first day as normal. It was a learning curve for Linda, but she took it in great stride. We did a lot of, you watch me do it, and then you do it. And soon she was running her own zone.
I love being able to go in and ask her after she's worked in the ER, what was it like? She's able to talk about things that we might need to do to address the work environment. She's able to talk about how important it is to have a good preceptor, how important it is to onboard, because even though Linda's been here for 20 years, this was a whole new job for her. If you think about her role leading people, for her to see firsthand what it's like to be new in a job and how important it is to have somebody teaching you, being patient with you, taking care of you, reaching out to you, that has been wonderful.
This experience has really helped me better understand how I and others in support roles can help our clinical staff. It was a long journey. I was determined to get through those tests, get my license, do the clinical rotations at Grady, get through my orientation, because my goal was to be able to do clinical care. And now I am. Every shift I'm intimidated, I'm nervous, I don't want to make a mistake, and I'm just in awe of all these very experienced physicians and nurses and techs, respiratory therapists. It's just amazing. I mean, I'm still amazed.